The next thing I want to look at is heart physiology. And just to make sure that we're all on the same page, what I want to talk about here are the following terms. Diastole, and this is the rest phase of the cardiac cycle. And systole, oh, I don't know the blue. There we go. And this is the contraction. The phase of the cardiac cycle in which the heart muscle is doing the work. Okay. The other thing I want to talk about is cardiac output. Okay, and that's represented by the following formula: stroke volume times heart rate. Okay. Stroke volume is affected by a couple of things. It's affected by the preload, afterload, and contractility. Okay. Preload is essentially the force. If you were sitting inside of the ventricle, let's say, it's the force that you would experience inside of the ventricle that has to do with the volume of blood that's in there and also the stretch of the muscle. So you can imagine it's a closed chamber and there's a certain volume in the ventricle, and that volume is also stretching because the myocardium is elastic, it's stretching. So the force that would be experienced inside of there just before we contract and everything goes out, that's the preload. Okay? Afterload, that has to do with the resistance. It's to do with the resistance of the systemic circulation for the left ventricle. I mean, the pulmonary circulation, yes, for the right ventricle, but most of the time we're talking about cardiac output. We're talking about the cardiac output of the ventricle, the left ventricle, because that's what's perfusing our body. And so we're talking about the resistance coming from the vasculature that's out there in the periphery. So all the arteries, arterioles, and capillary beds, because it's a closed system, and there is some tone to our vessels, they inherently have a resistance to the forward motion of blood. And so we call that the total peripheral resistance. Okay, and that's afterload. And essentially, the ventricle, with its contracting and this shortening of the muscle fibers, this is the force that has to be overcome. So the force of the contraction needs to overcome the resistance to the forward motion of the vasculature, the peripheral vasculature. Okay, and so that's what we have to overcome in order to push fluid out of the left ventricle and then out into the systemic circulation. Okay. And then the contractility is just in terms of the ability. It's an ability of the heart muscle to contract. So it's kind of characteristic. Okay, so then when we consider the cardiac output equation again, then we know for any Brady arrhythmia, heart rate goes down. Okay? If heart rate goes down, by this math equation, cardiac output will go down. A direct relationship. Okay? Then for a tachy arrhythmia, heart rate goes up. Initially, the assumption, cardiac output will go up. Again, a direct relationship when you look at it mathematically. However, what happens in the case of tachycardia or in the presence of tachycardia is we start to affect stroke volume. And what happens here is because the time spent in diastole decreases, and this is the time that we fill, because filling of the ventricle is passive from the atrium, we decrease our filling time. So if we decrease our filling time, then we decrease the ventricular volume. And if the ventricular volume is down, then obviously on one contraction or one squish, there's less volume in there to squish out. So in a tachyarrhythmia, stroke volume starts to decrease because of this decreased filling time. So even though heart rate is increasing in a tachyarrhythmia, stroke volume is decreasing. And initially, this is big, this is small. But as tachycardia continues or the rates increase, even though heart rate is increased, there's a larger effect to decrease the stroke volume. And then this is the scenario where we don't compensate, and then you see cardiac output decrease.